everyone having access to the sessions. It's really truly about outreach. It's about making sure that you guys get the information that you need. You are the experts. You're the ones doing the jobs. You're the ones out there in the trenches. You're kind enough to invite me over and letting me see your facilities, either a medical facility or your general industry facility. So after the pandemic's restrictions eased up a little bit, I went out there and we resumed our audits. And we have found that some of the issues with bloodborne pathogens have to do a lot with the lack of records, lack of appropriate training. And the one thing that keeps being missed as an actual written or organized, well put together part of your exposure control plan is your sharps injury annual review. So I will touch on that, and I will also touch on the responsibility that many of you have with your employees to provide with an awareness training program for bloodborne pathogens prevention. Remember, there's a ton of other classes that we also touch for you guys that have an interest in aerosol transmissible disease. And for the 17th and 18th, I think we have the one on silica dust prevention. So please don't forget to check out the website and write down the dates. My information is on the screen. I have been an authorized OSHA outreach trainer since 2012, but I opened my consulting firm in 2011, and I set myself to go out there and visit many parts of the country. And so I know that several states have their own program. We have here in California, OSHA, which is an federally approved state. So what I have on your screen is the quick takes by federal OSHA. If you haven't, and because this class is about the safety updates, if you have not gotten yourself subscribed to this newsletter, that's a big mistake. If you're in safety and you don't get this twice a month newsletter, it's a mistake, because it really keeps the pulse of things that are going on with safety out there. Federal government will put out new guidelines or standards, and each state has 6 months to come up to the same standard, to the same level of efficacy. So we may not copy the standard or the guide just the way they have it, but we are required to look into it and do something about it. So following with quick takes you to look into your own state program, in our case is OSHA, to see where we're up with that specific issue. So at this point, we have great tools for holiday workplace safety. And if you touch on that holiday shopping season link, you will be taken to a wonderful page of resources. So it goes from ergonomics to workplace violence to how to deal with crowds. So don't forget to subscribe to the quick takes and make sure that you get the updates for federal OSHA, and then you can go and check in your own state website to take a look at where we're at with that specific issue. So that's a wonderful way for those of you that are looking into keeping up to date with OSHA. So I just gave you a wonderful tip to keep up to date with OSHA and with safety regulation and with safety standards. For today, our learning objectives, we have, bloodborne pathogens as the topic. We want to make sure we bring you updates. We want to make sure we highlight those issues that still bring injury at the workplace. We know that we continue to have about 385,000 nurses suffering from injuries and needle sticks, and not just needles, but from sharps. And this statistic, this number, 385,000 a year, is based just on personnel at hospitals. We know that there's a big number of other needle sticks and sharps injuries that occur in general industry, manufacturing, construction, that have to, for example, I'll just give you an example, window installation. And there's an injury and there's blood on the glass and people do not know how to pick it up, and then they have an exposure to somebody else's blood. So all of those are not taken into these statistics. And still, we have more than 1,000 injuries a day nationwide. That's a lot of sharps injuries, needle stick injuries, just within our hospital-based staff. That's a lot. So we need to bring it to a lower number. And just so you know, we do have, we did see a reduction nationwide in the amount of sharps injury, needle sticks injuries from 2000 till about 2010. And the main reason for that was because of the enactment of the Needle Stick Safety Act in November 6, 2000. So we did see a steady decline of those types of injuries. And in 2010, we kind of had like a halt and we couldn't really get better numbers. So we're working on it. And this is why we're doing this outreach today, to continue to bring to light those issues that are not improving at our places of employment. So the objectives: understanding the importance of bloodborne pathogens training for all types of industry, not just healthcare, and listing 3 of the changing technologies that will help you and your mandated exposure control plan review, because you're required to annually, once a year, take a look at what's going on in your facility. Take a look at the needle sticks or any of the engineering controls that you're using, and make sure that you update your exposure control plan, and that for your sharps that you actually review the technology that you're using and improve it. So bring new devices to the workplace, test them, make sure nurses and physicians and staff tells you how they feel about using it. Is it good quality? Is it poor quality? Is there anything out there in the market that is better for them? Remember, you can actually chat with me, or you can unmute yourself. I love interruptions. I don't mind. Why? Because it brings your knowledge to the table. So it's perfectly fine. And a link for the newsletter. You just need to put OSHA.gov, and the first thing that appears there is an actual request. If it's the first time you get on the OSHA.gov website, it will appear as do you want to subscribe to our newsletter? So say yes, and they will send you an email. It'll be awesome. Very quick, very easy. No need to fuss. And twice a month you get that, and you keep an eye on things that are changing within the safety regulation standards federally and within your state. And the last objective for today has to do with discussing those requirements for general industry in comparison with those more extensive within the healthcare community. So basically, if you want in-depth bloodborne pathogen training, you really need to, and it comes two-phased, right? You may be seeking in-depth training to know how to impart this knowledge, right, to your facility. And if that's what you're looking for, you can actually have a guide through Cal OSHA's tools, and I'll show you some of those resources. And you can also take a look at the regulation, which delineates how to do training for your employees. What's the mandated training? What are the topics to cover? And who should be doing the training? So it should be somebody knowledgeable in the topics that are listed in the regulation. It doesn't need to be a nurse. It doesn't need to be a doctor, but it does need to be someone that is able to answer questions regarding some of the viruses that we discuss and why we're worried about them when we talk about bloodborne transmission. So we are going to talk about some of these issues. The objective today is right on your screen. The objectives are on your screen. But remember, this monthly series is about bringing you updates, kind of throwing light on those issues that continue to cause a high experience modification rate for you, employer, meaning you're having a high number of injuries, right? And that's why your insurance is sucking the life out of you, meaning you're paying higher rates. So we want to help with that. But we also want to throw light on those issues that are not improving, and that's the reason why our employees continue to get hurt. It's all about us as employees. It's all about us as managers to improve our systems for safety. All right. We know that healthcare is covered. That's not a question, right? Because physicians, nurses, as a matter of fact, the number one type of employees suffering from needle sticks and sharps injuries are nurses nationwide. Hands down, they're the ones that are the bigger or the chunk of the statistics. They're the ones that are giving us all those numbers. Nevertheless, 50%, it is statistically known that only 50% of our nurses are actually reporting sharps and needle sticks, and sharps injuries and needle sticks, which is an outstanding percentage, meaning, wow, That means for every 2 nurses that suffer an injury, only 1 will be brave enough to report it. And that's because many times they're like, you know what, it's not that important. I'm not sure if it was contaminated, etc. So there are some issues because, of course, nurses need to go through training in regards to knowing how to report, right? Because we have to have systems in place for them. We also know that other types of industries, such as, let's say trash haulers or maintenance people, will encounter issues such as needles in the trash or sharps in the trash that will pose an issue of cuts and contaminated sharps. And then we have the issue of when do we have exposure? Because remember, having a bloody item doesn't mean there is exposure to blood of OPIM. Blood or OPIM. And when I say OPIM, you already know is other potential infectious materials. We need to always delineate within our training for our employees, what are the instances that represent an issue of exposure to blood and OPIM. And that means you are exposed to someone else's blood, That's what it means. Not that you get cut and that's an issue because it's your own blood. That's not it. An issue of exposure where you may have the risk of contracting any of these viruses that are in blood or other potential infection materials are whenever somebody else's blood is on an object that you touch and abraded skin or cuts get in contact. So there's an entry point for those viruses, a transmission route, and a splash of somebody else's blood or bodily fluids to the face or mucous membranes or open cuts and even acne, because that's abraded skin, right? And the other thing would be percutaneous, which would be with sharps that are contaminated, but those sharps need to be contaminated. So they come in the form of needles, glass, scalpels, etc. So in general industry, we need to identify those jobs and those tasks that represent the issue of needle sticks and sharps, right? So if they're moving furniture and maybe they're dealing with broken glass, or sharps that they found within trash enclosures. And even at offices, right? When we talk about office work, many times we say, you know what, someone came in and fainted and they hit the desk and now there's blood on my desk. What should I do? Can I clean it? You require training to be able to clean and disinfect a surface that has been contaminated with blood or bodily fluids. So it's important to throw light to this thing. So even activities such as picking up trash and all kinds of construction activities, manufacturing, warehousing, construction, delivery, installation, and of course, all healthcare and emergency services need to make an analysis of whether or not their employees will ever have exposure to BBP, blood-borne pathogens. And remember, there are many viruses that could be in the blood of human beings that could be transmitted, right? Nevertheless, we worry only about 3 because those are the ones that represent the higher risk for our workers. And those are hepatitis B, hepatitis C, and HIV, the virus that causes AIDS, right? And there's still no cure for it. So we need to make sure that we analyze who may have issues of exposure, because it is mandated to do this risk assessment, right? Once you understand there are a part of your workforce, there is a part of your workforce with exposure to bloodborne pathogens, then those are the employees that will be covered under the regulation. What regulation? Section California Code of Regulations 5193, bloodborne pathogens exposure. Does this regulation apply to you? So the full regulation applies to all occupational exposure to blood and other potential infectious materials. So I know it sounds like a mouthful for those of you that are in general industry, not for those of you that are in healthcare. But what it means simply is making exactly what we just went through. When I showed you this first slides, I said, when you are doing, construction, warehousing, etc., you have to do an analysis of the hazards present at the job site. And if one of the hazards is, for example, that your workers will encounter needles, for example, at a trash enclosure, or that your workers are working as teams installing glass and windows, and there's a possibility of breakage. How should they work together to prevent exposure to blood and OPIM in case it happens, right? So you make the analysis, you determine who is exposed to blood and OPIM. And when I say OPIM, other potential infection materials, there's an actual official definition, and you can go to the CDC website and they will make a list of what potential infectious materials are. And of course, it includes blood and includes like other fluids that are pleural fluid, synovial fluid, cerebrospinal fluid, of course, vaginal and semen. All of those secretions and bodily fluids that are on that list are part of the potential infectious materials. But there are some of those bodily fluids that if they do not have blood, visible blood in them, they're not considered potentially infectious, right? We have feces, urine, tears, sweat. So the list, it's surprising sometimes to some of you. So I really encourage you to take a look at those definitions. I'm big on reading definitions so that we understand the actual context of the regulation you are looking at. And the reason why that's important, and maybe surprising to you, is like, oh, I thought all bodily fluids are infectious. Well, that's not really the truth. What it is that for work and safety related purposes, we use the concept of universal precautions, which is the umbrella for which we have standard and transmission-based precautions, right? But universal precautions basically says treat any and all bodily fluids as if they were infectious. But, you know, science is able to tell us, you know, the viral count, and we're able to tell in which specific bodily fluids you would encounter more of this viral load than in others. That's why we have a list for what occupational exposure to blood and other potential materials is versus these types of bodily fluids are not potentially infectious, right? Very good. So it does say very specifically that the regulation does not apply to the construction industry. Do I tell you to pay attention to this? Yes, because then that means you're not required to have an exposure control program with the entire requirements of the law. But because of the requirement under the Injury and Illness Prevention Program, you are required to look at the hazards at the workplace. Effective July 1st, 1991, remember, every employer in California has to establish, implement, and maintain an effective injury and illness prevention program that includes, and it delineates 8 elements. And one of those is hazard recognition, right? Through inspections. And with the hazard recognition, we know now that we must take into account any and all hazards that our employees may encounter at their job. And one of those is exposure to blood and OPIM. So if that's the case, now you are going to make a list of the jobs that have exposure so that they are covered under your bloodborne pathogen exposure control program. If you don't have any jobs or occupations with exposure to bloodborne pathogens, then what you are going to do is create an awareness program, right? And you're going to create also a training session for those instances that may be rare, that do not represent occupational exposure, that may be brought by working with other employers, or simply because of the issue of someone having a bloody nose at work, that kind of thing. And you do need to discuss this with workers. You need to make them aware so that they don't jump in and try to help someone that is bleeding without the training and the proper barriers. And when we say barriers, we're talking about gloves and personal protective equipment. Otherwise, they will be tempted to you know, provide, let's say, with paper towels, or help the person and get blood all over their arms or a splash in their face, whatever it is, and have an actual issue of exposure to blood and OPIM. So there's an actual definition, like I said, of what occupational exposure means. It says reasonably anticipated skin, eye, mucous membrane, or parenteral. And parenteral means, you know, like with needle sticks or any sharps, contact with blood or other potentially infectious materials that may result from the performance of an employee's duties. And so that's when the training takes place, and you have to explain to the workers that means somebody else's blood. Your blood is your blood. If you get cut, we're talking about a different issue here. How do we prevent nicks and cuts at the workplace? That has nothing to do with bloodborne pathogens. And in a sense, does, because you don't want to leave that worker's blood on a surface, right? So we need to tackle those things accordingly. But occupational exposure is precisely what a nurse, a doctor goes through. Even when we talk about other occupations such as trash haulers or providers of first aid, right? All of your first aid providers may are reasonably anticipated to have skin, eye, mucous membrane, parenteral contact with blood and other potentially infectious materials. So that's part of your analysis. You make the list of the jobs and you're going to cover them under the standard and all of the requirements of this regulation. And that's where training that is specific to the reg comes into place. So some of you have a binder with the exposure control plan printed and ready to be shown and explained to your workers. I think that's a very good way of doing it, because a lot of us are used to having everything electronically and to access electronically all these documents. And that's fine, but remember that when you do training, it is good to have something that they can see, highlight, make notes on, and also during their daily work activities that they can access, that they can remember what that exposure control plan is all about. So it has to be in writing. There's a requirement to review it and update it annually. And there's a requirement to look into the technology that you're using or providing to your nurses, physicians. So once you have exposure to blood and OPIM, there is a part about discussing the sharps and the needleless devices or the engineering controls that you're using at the workplace and improve them every year to get input from workers and employees. So the plan has to be accessible to all employees. Work on that. Make sure that when I say that, if I look at what happens in real life, I'll tell you what my experience is. Any program that is OSHA mandated, that it is accessible to all employees, many times administrators feel that by having a password that magically opens all these documents at some when employees have access to a computer is the way to go. The problem is that many times those files have a special password, or you have to remember a specific way of getting to them. So without training, a worker may not have access to any of these safety programs. So it is a good idea as an administrator to have this both ways: printed, hard copy, and the electronic access. So that, because this happens, guys, whenever there's an OSHA inspection, an actual compliance safety officer at your facilities, they will look at how easily an employee is able to access these plans or these programs. So there are training requirements, like I said, according to this regulation. When we say CCR, that means California Code of Regulations, Section 5193. And so these training requirements are for those employees that you have put in your list of occupational exposure. So the rest of your employees are not going to receive this in-depth training. So remember that, please. You're only required to recognize hazards and provide training so that employees do not have exposure to that hazard. So if you have determined that, let's say 20 employees have exposure and 50 don't, you're going to provide the training that I'm listing here from 1 through 8. You're going to provide this training. I had more. It's actually 1 through 14. The regulation lists the 1 through 14. So I probably just put the first 8 to give you an idea of what the regulation is talking about. But there is actually 14 training requirements. So if in the list of jobs you've determined that 20 people are doing jobs that are related, that have occupational exposure to blood and OPIM, you're going to do in-depth training as mandated per the standard as you see on your screen. And for the other 50 that do not have occupational exposure, that need to be aware, because it is a hazard that may be present on a rare occasion, like what I said, a bloody nose type of situation. A worker has a bloody nose. What do? They left blood on their desk or the furniture or their chair or their seat or the truck that they drive. So how are we going to tackle that issue? Because it may happen. And although they do not have occupational exposure, we do need to have a program that covers that awareness training. So for those of you that were thinking, oh, this class is not for me, I am not in the healthcare or emergency services, I do not need to know about 5193. You do. You do need to know the basics. You do need to know how to put a training program that makes people aware of the hazard and how to prevent exposure to blood and OPIM, human blood and OPIM. So during the training that you are going to provide to those employees with occupational exposure, you're going to provide the number one with a copy and explanation of the standard. So that means that if you are the one in charge of doing safety training, you have to take a look at the regulation, because you have to be prepared with a copy of the standard, and you're just going to do a brief explanation. You're not going to explain the entire standard. It's quite a nitpicky standard. It's a lengthy standard. It's not one of those that is 2-3 paragraphs long, like ergonomics is, probably 4 or 5 paragraphs long. 5193 bloodborne pathogens is a lengthy standard. So it's good to bring a copy and briefly explain it to your audience or your trainees. You can also do this by recording a session, right? And then, like I said, you do the training online, and then there's a requirement for a Q&A session, meaning you have to answer questions at that moment live. But if you are setting up everything via software or video, that's allowed as long as you have somebody that answers questions within I think 24 hours after your session finished. So the best way to do that is just give him a phone number and tell him, after your session is over, contact so-and-so for the questions that you have pertaining to this training. And with that, you will be covered. You will be doing compliant training, because I'm big on that. Remember, many times we say, oh yeah, we received training. Oh, we're doing training for that, and we're doing training for that. But you are not doing safety OSHA compliant training if you're not looking at the requirements of each of the very important regulations. So this one has 14 elements. I'm only showing the first 8 here. A general explanation of the epidemiology and symptoms of bloodborne diseases. So you're going to find yourself speaking on or talking to your audience about hepatitis B, hepatitis C, which, by the way, is the most common chronic bloodborne disease in the United States. Most common right now, high numbers. People are walking around with this virus in the bloodstream, and they don't know it until they have symptoms or they have a test for something else, and then they come back positive for hepatitis C. You're going to find yourself talking about HIV and when, for example, percentages for conversion. You're going to find yourself talking about issues of vaccination and how many vaccines currently do prevent conversion to hepatitis B, the actual disease, liver disease, because it causes liver disease, or conversion for HIV. So all of those things really matter. So you could study this and you could provide the training, or you could ask one of your nurses and provide her with all of the requirements of the regulation so that she can study it and put together the actual training. Modes of transmission, so you need to talk to them about the routes, like we talked about. It could be a splash to the mucous membranes, or it could be contact with blood whenever you have a cut or abraded skin. And it could also be percutaneously, right? So needle sticks or sharps injuries. And you find yourself talking about this, but focus on the types of transmission that you would encounter at your workplace, right? So if I'm talking to my client who they are community appearance, they're not a trash hauler, but they do clean up and provide a lot of services of sanitation for apartments, for example. So what would they do? They would encounter needles sometimes. They encounter a broken glass. They encounter that type of thing. How would you, and because you've determined that those workers, that specific job, that specific position, that specific task, it represents the issue of exposure, then you're going to provide them with this type of training, and then you're going to provide them with the hepatitis B vaccine, right? Then you're going to talk to them about the exposure control program or plan, and it's a written plan, and when you're explaining it, you're going to tell them where is it at, how to access it. I have found, and this is where I have found that your employees really don't know how to access all these documents, and they should be able to obtain a copy. And it's mandated that you discuss this during training. Number 5 is the risk identification method for recognizing tasks and other activities that may involve exposure to blood and OPIM. Methods of compliance, number 6, will take you the longest time. And the reason is because now you're going to talk about engineering controls. Now you're going to talk about all of those things that help you, employer or nurse director or physicians, if you're in charge if you're the safety director of your facility, it's going to help you to prevent those sharps and needle stick injuries. And so you're going to talk about, well, the engineering controls that we have at the facility, for example, are, and then you have a display of what you have or pictures of what you have in the way of needleless systems and all of those wonderful new technologies to be able to help prevent, an actual injury. You're going to talk about engineering controls. Then you're going to talk about administrative controls. And administrative controls have to do with the way they do the job. So you're going to talk to them about, this is why we plan ahead, planning before we actually do the procedure, right? Because if you're in a long-term facility taking care of people, you have to plan how you're going to do the job that day in order to prevent injury. The same thing applies to sharps injury prevention. You want to make sure you plan the job, you plan the activity, you plan the procedure so that nurse or physician or employee who's doing the task has a way of consciously thinking of what they're doing, activating the actual safety device, doing it the right way, the correct way, and then disposing of it correctly. So, for example, we have several things going on with sharps injuries and issues of needle sticks at the workplace. So many times we blame it on carelessness or inexperience in the part of the worker. And yes, sometimes that could be the issue. But remember, that's only the human part, the human factor, right, of the equation. Because those of you that have taken incident investigation with me know that there's a lot more to each incident at work. We talked about surface causes, root causes, and all of the contributing factors. But today we're focusing on, remember that it's not always the carelessness and the inexperience. Many times is a marriage of this lack of updating your own programs, updating your own technologies, and getting input from your employees. So a nurse, I was reading several stories today for this class, and one of them said, I was walking around at a patient's room and a suture needle went through my shoe. And that is an actual exposure incident, because we don't know if the needle was contaminated, but it was inside a room where a procedure had taken place. So it is assumed that it is a contaminated needle, went through my foot. So that is an issue of exposure. She obviously went through the post-exposure prophylaxis, which is an entire procedure that you're going to delineate, right? Person is going to, they need to know what to do, which is washing the area and then making sure that they inform their supervisor or employee health department. And then they're going to go through a series of treatment, right? And the administration of maybe prophylactic drugs to prevent the conversion, right? Especially in this case, for this particular nurse, she knew that the patient in that room was positive for hepatitis C. So throughout a period of 6 months, there's nothing, you're sitting ducks with hepatitis C. There's nothing you can do except wait to see if there's conversion. And after testing and testing and testing, and you can only imagine the emotional and overwhelming feelings, right, of that employee, because for 6 months, and by the way, she was pregnant. So it is awful. And thankfully, she did not convert. She did not ever tested positive for hepatitis C. But there is this other cases that we have those because there is risk. And when you see the numbers, you may think, wow, for example, for HIV needle stick, there's only a 0.3% chance of you actually converting and for the test to come back positive, right? For a needle stick type of injury, contaminated needle stick, HIV. And so that means that there is what, a 99.7% chance that you won't contract it with a needle stick, but there is that 0.3%. And for those that have had the bad luck of contracting the disease, it is awful. There's no cure. It's a lifetime of pain. And, it's not just the emotional cost, the societal cost, the actual cost the company, the loss of productivity, loss of morale, loss of your career, And with that, I want to leave you with that thought, because there's nurses that, and this particular nurse was telling her story. And one of the things that she was saying is the sharps container was too full. And yes, I contracted HIV and hepatitis C because of this needle stick injury. That's terrible. And it all has to do with all of those administrative controls. And that's why number 6 says methods of compliance. And it's about you knowing what are you having in place to prevent sharps and needle stick injuries. So engineering controls, needleless devices, etc., and all of that technology and all of those things such as containers and better devices that will allow people not to get hurt. And the next thing is the next layer of protection, administrative controls, right? So how, because so many of those devices have a specific way to activate the safety device. And if there's no training and education, a nurse may be tempted to use her other hand instead of using a one-hand technique. And there it goes, my sharp injury, right? So methods of compliance will take you the longest. That's why I said don't take too long explaining the standard. Focus on those things that really matter. Methods of compliance, engineering controls, administrative controls, personal protective equipment. Remember that when we talk to remain at their jobs, if they're test positive for incurable. No, there's an actual requirement to look into the actual, because this is a very good question. Do you know if nurses and doctors are allowed to remain at their jobs if they test positive for HIV, for example? So an analysis needs to take place as to the type of job that physician or nurse is doing, and accommodation needs to take place because that has to do with ADA, Americans with Disability Act. And because this is something that is non-disclosable and it's an issue that represents a safety issue for the patients, the clients, etc., there has to be accommodation. So if they can remain in their same position is something that needs to be analyzed. So an analysis needs to take place and accommodation needs to take place. So great question. Thank you. So it goes case by case. That's the answer, case by case. Personal protective equipment, the contamination and disposal, then a requirement for an explanation of labels and the signage used in regards to biohazardous and how to handle biohazardous waste. There's also requirements for recording, requirements for post-exposure prophylaxis, requirements for providing information to physicians and how long do they have to provide the information back to employee in regards to their exposure, and how to keep these records, etc. So all of that, it's discussed during the training because employees need to know how to report an injury, the process that is going to take place, and what will take place, and the types of solutions available to them, not just the vaccination, but any type of treatment, prophylaxis treatment available to them. And the fact that it doesn't need to be a physician within their own facility that does the evaluation, they can also choose to go somewhere else. So I put here some of the resources that you may find helpful. So there are some key recommendations by the CDC for sharp safety in dental settings, for example. And I love it because this goes into exactly those methods of compliance, which is engineering controls, administrative controls, and PPE. And I love it. Consider sharp items such as needles, scalers, burrs, lab knives, and wires that are contaminated with patient blood and saliva as potentially infectious, right? And establish engineering controls and work practices to prevent injuries. And so that's a mouthful, but what it means is take a look at what devices are available out there in the market that are better, that the actual safety device is activated with less steps and represent something that we can use in our dental setting. Do not recap use needles by using both hands. Now, number 2 has to do with administrative controls because that's the way we do the task. So techniques, any techniques like recapping a needle, is it really necessary? What it says is do not recap use needles by using both hands or any other technique that involves directing the point of a needle toward any part of the body. Those are techniques, the way to do a job. That's an administrative control. Number 3, use either a one-handed scoop technique or a mechanical device designed for holding the needle cap when recapping needles. Because in dental settings, they do the multiple injection. And before it says, example between multiple injections and before removing from a non-disposable aspirating syringe. So techniques, again, this is part of what? Administrative controls. Number 4, use disposable syringes and needles, scalpel blades, and other sharp items in appropriate puncture-resistant containers located as close as possible to the area where the items are used. So I know there's a lot of information out there that seems really good that you're like, hey, I need to look into it. Not just looking into it, but when you have all this knowledge, walk through your rooms, walk through the procedure rooms, walk through the ORs, and take a look at how close those containers are at, how if it makes sense for nurses, for physicians while they're doing a procedure, how easy it is for them to dispose of those sharps appropriately, right? Because remember that disposing of sharps appropriately also will help with the risk that is associated to those downstream workers, right? Like your janitorial services or those picking up those containers for disposal. So please use disposable syringes and needles and other sharps in appropriate puncture-resistant containers. That has to do with engineering controls because puncture-resistant containers are an example of engineering controls. And the better devices that you use and the more training and awareness that you do, outreach, the better it will go. For example, overfilling containers, overfilling any kiosk wherever the public will deposit, for example, insulin needles. All of that really matters because it's part of safe disposal, which is, by the way, we have a high number of needle stick injuries because of containers being overfilled. Key recommendations for safe injection practices in dental settings: prepare injections using an aseptic technique 2 in a clean area, disinfect the rubber septum on a medication vial with alcohol before piercing. What is this here? Administrative controls. It's worth taking a look at what's the newest and latest by those organizations and governmental bodies that help us with, this is the research. We've done the legwork. This is what we have for you. And this is at that CDC link that I have on this slide. And I'm going to send these slides to you. I always do after the session. Oh, here it is, the rest of the requirements. Everything about the hepatitis B vaccination needs to be discussed with workers. What's in the vaccine, right? It's yeast-based. What are the secondary effects? What type of, many times you have nurses and more educated staff in this particular topic that will ask more questions, such as, I don't have proof of my vaccination. Should I get the series again? Or, they told me that I only need to have it on a 2 dosage type of brand versus the 3 dosage, and what is the difference? And if I started with one brand, can I go with the other? So you need to have answers for them, and the person providing this information needs to be knowledgeable. Next would be emergency actions to take and persons to contact in an emergency involving blood or OPIM. So you need to tell them how that is. So if it's an emergency center where they need to go right after an exposure control occurs, a splash, a percutaneous injury, etc., where that is and who do they talk to, it needs to be easily accessible. Number 11, exposure incident, reporting the incident, the medical follow-up that will be made available on how to record the incident on the Sharps injury log. Administrators, don't forget you have a responsibility for filling out a document called the Sharps injury log, right? That's a form that is specific and it has specific fields by Cal OSHA requirements. The information, by the way, all Sharps injury need to be also recorded in your OSHA 300 log. So there's 2 logs, right? One is the specific Sharps injury log, and the other one is your OSHA log, which is the log of injuries. There's all types of injuries on that log, such as falls, slip, strips and falls, ergonomics, etc. And Sharps injuries are considered privacy concern. That means you wouldn't put a name on it, but you would put a key code or number. But you need to have it in your OSHA log aside from your Sharps injury log. Information about post-exposure evaluation and follow-up. So where they go, which doctor will take care of them, or where to call for help. Signs and labels, explanation of the signs, labels, or color coding, because you may have red bags instead of bags that are showing the symbol for biohazardous materials. interactive questions and answers is the number 14 requirement. And like I said, you can do web-based or software-based training. You just have to have a person that is available to answer these questions right after the person takes this training. Additional training is required for employees of HIV, HPV, and HCV research laboratories and production facilities. So there's a whole section for lab workers. So you need to take a look at that. Now, what I have on your screen is something that I put together for those clients of mine where we do not have any employees that are exposed to blood. So there's no occupational exposure to blood or OPIM, but they do have the instance, for example, if they are delivering, let's say they deliver product, and when they are driving their truck, there is that possibility of them being involved in a collision, a car collision, right? An accident. When blood is involved, they need to know what to do. And they need to know that if their body is bleeding, we do concern ourselves with 3 main viruses, which is HPV, HIV, HCV, especially if the blood of that buddy can come in contact with open skin, abraded skin, or if there's sharps that are contaminated with blood that puncture their skin. We need to discuss this thing. So we talk about how may I be exposed to this virus at work. So this is just an example of what I was telling you about. For those that are occupationally exposed, you do the actual training mandated by the regulation. For those that are not, you have to prepare something like this, where you tell them, why do we worry about this exposure to blood and OPIM, even if you're not a doctor, you're not a nurse, and you do not usually would have an issue of exposure. But why do we worry about it? Because we know there's risk. And many times people don't know that they're carriers or that they have this virus in their bloodstream. And you may be exposed to it by being in a car accident, right? And so we talked about them briefly about those viruses and what it means, OPIM, other potential infectious materials. And basically what I tell them is, listen, if it's a bodily fluid and it's not yours, treat it as if it was infectious, right? You have a first aid kit all the time. You have to have barriers. First, try and get that person to administer self-aid, right? Which is, you see that they are bleeding, there's a wound, have them raise the arm if they have a cut in their arm, or apply pressure on the wound. So you go through some basics, right? For some of you, you do have first aid, CPR trained people on site. And those of you that are even smarter, you have at least one person in each of your teams that is first aid and CPR trained. Why? Because it's very important that they're able to respond to situations like this. And when they get trained, they get even information as to, how important it is to barriers like gloves or resuscitation masks, etc. Then you give them a process or a procedure and what to do. Call 911, have the person administer self-aid, etc. And the forms that they need to fill out and who do they need to contact, important phone numbers. So this is a good discussion that you will have. And then the next thing that I give them during awareness training is an acronym that I put together. And, I was looking at some of the nursing or other training programs, and the acronym they use is WIN, W-I-N. I use WISH because in the beginning I thought, I wish this never happened to me, right? It's very emotional. Needle sticks and sharps injuries become very overwhelming, right? Because that's all you're thinking about. You're worried about your health, what will happen to your family, etc. So once you have an issue of exposure to blood or OPIM, you wish it never happened to you. And if you wish it never happened to you, W is for washing, right? So you immediately go water and soap to that area that you were in contact with somebody else's blood. So if you took care of someone that fainted and bled on you, you go and wash that arm where they bled on you, right? You take care of making sure that your clothes and everything else, you wash. The I is for informing your supervisor immediately. So if it's a needle stick, you're going to wash that hand or that finger that got stuck with the needle, right? Washing. Then you go and inform your supervisor immediately and before the end of your shift. Then the S is for source individual, because it is important to find out where is that blood coming from, because we need to test that individual. We need to ask permission and find out what's in the blood of that person whose blood we were in contact with. And that way we're going to know if they are positive for hepatitis B, C, etc. And now the H is for health. Now it's all about my health. Now that I know that the source individual has been identified, the doctor will have all of the information they need to give me the medical attention that I need, right? And we call that post-exposure prophylaxis, evaluation, and treatment. So WISH is a good acronym to remember and to distribute amongst the rest of your workers if it's an awareness level only. And even for your nurses, right? Some of the nursing trainings that I have done, they told me that they use the WIN, and the WIN, the W is for washing, the I is for informing, right? And the N is for notifying. Actually, I is for, I forgot, because I always use WISH, but it's not informing because the N is for notifying. So I believe the I has to do with the source individual, because it's super important to identify it. And many times you won't be able to, right? For example, in certain occupations, like what I was telling you, if you are a company that picks up trash, and you encounter needles, or even a janitorial service that cleans buses, for example, and you get stuck with a needle. Those are some of the issues that, well, there's nobody in the bus any longer. You cannot identify the source individual. What do you do? And so when I provide this acronym, I also provide with an 800 hotline that was or is available, and clinicians are during certain hours available to talk to you, employer. And so this is why it's so important to inform to your supervisor immediately when that happens, because if you were stuck with a needle and you don't know who the source individual is, these clinicians are able to make a determination at what the next step is or will be, based on the amount of blood that sharp had. Was it visible? Was it not visible? Was it a splash? How much of a splash? Was it bloody? Was it not bloody? That kind of thing matters. And they are really good at doing this post-exposure prophylaxis, evaluation, assessment, treatment. And so if you don't have an 800 line, there it is. Post-exposure prophylaxis line 1-888-488-4911. And that is the hotline that you need to have. Emergency needle stick information. So this is a great slide for that number. If you didn't have it, make note of it, include it, and add it to your awareness training and to the training that you have for those receiving reports of sharps or needle stick injuries. OSHA has a page in regards to bloodborne pathogens prevention. And I love this, which is the 5 ways to prevent sharps and needle stick injuries. And, you know, if you have to wrap it and summarize it into 5 things, I love what they put together for us. Number 1, plan safe handling, right? Because when you plan, you're paying attention of what you're doing, and you're safe handling and disposing before your procedure. You know how you do it. Where is the container? How close is it? Do I have to take a step, or is it right there next to me? Can I bring it next to me? Can I put it right next to where the procedure is taking place for disposal, which is very, very important. Use safe and effective needle alternatives when available. So if you have needleless systems, use that. Remember that the hierarchy of controls is eliminating the risk completely. So if you can go back for a needleless system, that's the way to go. Number 3, activating the device safety features and activating them correctly, because you will see those sharps protection devices that need to be activated with the same hand, and you will see instances where you use the other hand, and that's, you know, that lack of being conscious of this is how to use the device. Immediately dispose of contaminated needles in OSHA compliant sharps containers, because they need to be puncture proof, right? And they need to be labeled, etc. Complete bloodborne pathogens training. And now we know that when we say bloodborne pathogens training, it needs to be compliant with the regulation, and it's a long, lengthy training. So you can't just do it without being conscious of the requirements. So I have some resources for you. There is a workbook that is designed for healthcare and other types of settings. It's a beautiful workbook, and I strongly, there are forms in there that are just the thing and the way to go. Some of them are meant to just provide you with an assessment of where you're at with your sharps injury prevention program, and some others are meant to be used on an ongoing basis periodically. which is part of your injury and illness prevention program. If it's really effective, you're going to have this ongoing assessment of your programs to prevent injuries. And so I give you the link, but if you don't have it, here it is. So evaluating and implementing. And so as you can see, it'll go through about the workbook, who should use it, risk and prevention of sharps injuries in healthcare personnel. I love that it goes into the cost of needle stick injuries, because at the low end, you're talking about a $5,000 type of cost for one needle stick injury. And that's not talking about the rest of the indirect costs, right? When we talk about indirect costs, we talk about people that are emotionally distracted, loss of productivity, loss of time, precious time that you have to use to train somebody else. And those are all of the costs that are not taken into the direct cost, which will be shown also as part of this workbook. And then it goes into organizational steps, developing your capacity, assessing your program, assessing the culture of safety of your facility. I think this is fantastic. Your procedures for sharp injury reporting, methods for the analysis and the use of sharps injury data, assessing your process for identifying, selecting, implementing engineered sharps injury prevention devices, assessing programs for education and training of health personnel, preparing a baseline profile of sharps injuries and prevention activities. So this workbook will really take you through a very detailed way to do sharps injury prevention and improving what you have. So if you already have a program, this workbook will also help you go to the next level, right? And really institutionalize a good culture of safety, strategies for actually creating that culture of safety, which is difficult to create because many of us think that just by having a sign that says safety first, we will do a good job. But the truth is, a safety culture is from the moment you get to your work, assessing the hazards and being aware and knowing and being empowered to actually do something not to get hurt is the way to go. So like I said, there's good forums in there, and there's some resources that I put there for you in regards to the bloodborne pathogens exposure control, best practices, and how to document what is needed in the requirements. So for that annual update, you do have to have an analysis of those newer, better technologies, and I put some resources for you. So 5193 also allowed, and this is just a reminder because I talked about the sharps injury log. The regulation says 14 working days to enter the information in the sharps injury log. There are some record keeping laws. So aside from the sharps injury log, you have 7 calendar days. So there's 2 deadlines there. 14 days for the sharps injury log, 7 calendar days after you receive information about a case, you need to put it on your OSHA 300 log. So that's important to highlight. And then more research regarding the latest and newest, the update for the guideline for isolation precautions preventing transmission of infectious agents in healthcare settings was updated in May 2022. And this is why you take this class, because you want to know of updates. So take a look at this document by CDC and then go all the way to page 57, and they will delve into prevention of needle sticks and other sharps related injuries, mucous membrane contact, precautions during aerosol generating procedures. There's another document called the Perspectives in Disease Prevention and Health Promotion Update, Universal Precautions for Prevention of Transmission of Human Immunodeficiency Virus, Hepatitis B, and other bloodborne pathogens. That's a beautiful document that will throw light on some of the issues that are happening right now. More resources for you to be able to control exposures. And for the control of exposures, I really want you to take a look at these resources. There is a list of devices by the CDC that is updated all the time that talks about good things such as good products. They're not endorsing the products, but they do talk about, for example, hypodermic needles. And in the case of this video on the left of mine, maybe you're right, that's an ampule breaker, and that is in the list of CDC, better technologies, better devices to provide to your nurse and your staff. So another and last research that I have for you is the CDC bloodborne pathogen infectious disease general resources page. And so you can get it by clicking on this link. I hope this has helped you kind of get your mind working on to improving your system today. And more than anything, I wanted to throw light on those issues that continue to cause problems. And it has to do more than anything at this point with improving your system and doing that annual review of your current technologies. So go ahead and take a look at this list, take a look at what you're using in your facilities, and do a good review. Get your employees' input, nurses, physicians, and your staff. They're the best source of information. Thanks again for listening and for being here today. Lindsay, I will send you this right now so you can distribute them amongst the people that were here with us today. And then I have a last question here. Ask permission to test blood from the source individual only, or any other regulatory entity? No, just the person who is the source individual. They just need to give you consent. That's basically it. So thank you so much for the questions. If you have any other questions after today, email us. We will happily answer your questions, and that way we will spread the knowledge, and you will also help us understand more of what you go through at your facilities. Thank you, Lindsay, and thank you all of you. I'll see you next month. And for those of you taking the silica dust prevention class, I will see you in a week and a half or so.
Yes, thank you so much, Alba. We'll see everyone in January for the next session.
Okay. Thank you, everyone. Thanks, Lindsay.
Take care.
Have a fantastic day and a great weekend.
You too. Bye-bye.
Bye.